Welcome into HealthWise, the TV show. I'm Ralph Hipp, your host. March is marking Colon Cancer Awareness Month, and it's a time when providers are spreading the word. This type of cancer is preventable, treatable, and beatable if, as you know, if it's found and addressed early. That's why colonoscopy screenings are so important, and physician assistant Tanner Speake, he is of the Cotton O'Neill Digestive Health Center, is with me talking more about how we can keep and get those regular screenings. Tanner, great to have you here.
Yeah, very nice to meet you.
All right, good to meet you too. We are both proud University of Florida trained Gators.
That's
and
right.
Good to have you on the program, Tanner. We've heard it before. Tell me, why are colonoscopies so important?
Yeah, so colonoscopies are important because as we talk about colon cancer, just as you had mentioned, it's something that's screenable and treatable and beatable. Colon cancer, it's estimated that in the year 2018 that over 50,000 deaths will occur related to colon cancer. And so colonoscopies are extremely important to have performed when appropriate so that we can catch this before it establishes itself.
Are there any figures, Tanner, or how many deaths are preventable? We know how many cases are preventable. How many deaths, how many lives could we save if people did this on a routine basis?
Well, it's a good question, and I mean, I would have to say innumerable. Really the role of the screening colonoscopy is to try to catch colon cancer before it's established, and so I think that the potential number of lives that we could potentially save with that is difficult to quantify.
Very large number.
Large number.
What are the rules now, and talk about whether the guidelines may have changed through the associations who promote this, but when and how often should we be getting our colonoscopies?
Yeah, so typically we say for everyone, men and women at age 50, we recommend a colonoscopy. That is a little bit different if there's a family history of colon cancer diagnosed before age 60. At that point, we recommend that you get a colonoscopy 10 years before that family member was diagnosed with colon cancer. Generally speaking, if you have a colonoscopy at age 50 and everything is normal, then you really don't need another colonoscopy for another 10 years. Depending on what we find, if you have polyps or other abnormal findings, we may recommend repeating colonoscopy in 3 to 5 years.
3 to 5 and not having to wait for the 10 years if you were clear that first time.
Correct.
So we should talk about it as family members, talk about our family history with that, share the information, right?
Absolutely.
So what's involved in getting ready for a colonoscopy process, Tanner?
Yeah, so I get this question a lot in clinic, and I know that there's a lot of
we need to drink some
talk
stuff.
about, there's a lot
mix it and drink it.
That's exactly right. It's exactly right. And it's a prep that you'll drink, and it's not the most tasteful thing that you'll drink, but really we need to get your colon cleaned out. And so we have you do this bowel prep, and you'll go to the bathroom a lot, but that will give us a good view of the colon. Otherwise, prepping for the colonoscopy will outline dietary things and fluids and recommendations from that standpoint.
Right. How can we reduce our risk of colon cancer? Obviously, by having this done, some of the risk factors that you'd like to talk about.
Yeah, so the biggest way to reduce the risk of colon cancer is to get screened on a regular basis. Absolutely, family history is a big indicator, a big flag that would warrant getting screened. Colon cancer is unique in that it really can present with many different symptoms. Some patients will really present without any symptoms and end up having colon cancer diagnosed on a screening. Other patients will have weight loss, abdominal pain, rectal bleeding, those types of symptoms. But it's a difficult diagnosis in that it can present itself in so many different ways.
Go over those symptoms and the risk factors again, and if we see those, we should act very quickly, obviously. What do we need to do if we begin to see those things happening?
Yeah, sure. So the big ones in terms of, if we look at the textbook and what that will tell us in terms of symptoms for colon cancer, weight loss, abdominal pain, rectal bleeding. Sometimes people have a change in their bowel habits. Anytime that you have those symptoms that you're experiencing, I'd recommend that you talk with your primary care physician, and at that point they can get a referral in for you to be seen by us and get a colonoscopy arranged.
How do we schedule a colonoscopy?
So
what's the procedure here?
To schedule a colonoscopy, typically it is something that you have to go through your primary care provider with, but they will call our clinic and they will get the colonoscopy arranged with you and go over the details.
Well, we're reminding you it's preventable, it's treatable, and it's beatable. And the number to call for the Cotton O'Neill Digestive Health Center is 270-4800 in Topeka. Do you have patients from all over Northeast Kansas who take advantage of the services here, Tanner?
Yes, absolutely. All over Northeast Kansas.
270-4800. What's the procedure once they call? What would be the timetable for getting them in? And how long do treatments normally take? You say it's treatable and beatable. And we've also talked about medical journeys, preserving the health of our patients, our friends who are watching at home. How long is the journey? I'm sure it varies from patient to patient.
Yeah, absolutely. It varies patient to patient. Depending on where the cancer is, sometimes we can resect that surgically. Depending on if the cancer is contained or if it is spread, then there are other treatments such as chemotherapy and radiation and things that may need to be considered.
Right. And when are those decisions made? How early in the process, well, we need this or we need that form of treatment?
Once we have the biopsies. So if there's a colon cancer, we get biopsies, we look at the pathology, and that will dictate kind of the treatment and the way that we proceed.
What do you think about being here? Are you a Kansan, Tanner?
I'm a Kansan, but I root for the Gators.
Well,
if
me too. We're both
enough.
in the same boat on that. Tanner Speake, thank you for coming over.
Yep, absolutely.
And good to keep everybody healthy, and thanks for coming to see us.
Absolutely.
Once again, the information, if you'd like to get in touch with the Cotton O'Neill Digestive Health Center, as Tanner Speake said, that number is 270-4800. And schedule your colonoscopy. Let's talk about it. Talk about your family history. Don't hide the information, share it. And all these things, remember that. If we have 3 words we want you to remember, it would be those 3. Call the Digestive Health Center if you're seeing any of those symptoms Tanner talked about at that phone number. Thank you, Tanner.
Absolutely.
We'll see you again later. A reminder that HealthWise is hosting those monthly senior suppers again at Stormont Vail Hospital on the 2nd Monday of the month, now through November. You're invited, and dinner is $5.15 those evenings for $5, followed by a terrific speaker on a health and wellness topic of interest. You can call that Health Connections number, 354-5225, so remember that number as well to make your reservation, 354-5225 for the programs in March, and we'll get ready for the one in April. Well, now we have our HealthWise TV exercise segment. We've got some fun exercises for you to be a part of, invigorating. They're fairly low-impact exercises. And be sure to check in with your doctor before you start this or any exercise program.